All right.
And I have a question. Is it normal that like your gum itches around your tooth? Like, is that normal?
Your gum itches around your tooth. No. Usually it might be some type of bacteria or something. So we could take a look at that. Um, but we're gonna do a teeth cleaning, so you don't have to worry about that. Honestly, if I do find anything, I'll let you know. But probably you just need a good tooth cleaning.
Okay.
All right.
All right, everything's set up.
Perfect. Thank you. All right. So you can go ahead and just lean back slightly. I'm gonna go ahead and put my gloves on, wash my hands. All right, put my PPE on. One more thing, Hazel, can you go ahead and um put the TV on? You can put the TV on, maybe a little bit of music down low, and you can hand Trinity the remote just so that she feels comfortable. I like to make sure my patients feel comfortable. All right. All right, and just let me know when you turn that joint on.
All right, here you go the remote.
Perfect. All right, so Trinity, you have all control of the TV. You could turn in any channel you want just to relax you a little bit more. I hate when people feel uncomfortable in the dentist chair. My job is to make sure your teeth are in best condition and you're uncomfortable as possible. Okay. All right, let's go ahead and get started. I'm gonna go ahead and lay you back gently. All right. All right, and then I just always gotta ask, can I take a quick look in your mouth, please? I already know the problems that you already stated. I'm just gonna go ahead and do a dental check, and then while I'm doing that, I'm also gonna go ahead and get started with your cleaning process so that I can get started with your braces, okay? So,
Okay.
I can take a quick look, right? I have permission, yes or no?
Yes.
Perfect. Thank you so much. All right, so I'm gonna go ahead and use my dental mirror to inspect your teeth and your gums. You already told me you had a slight itch on your gums. All right, let me know if you have any pain as I check anywhere. All right, and I'm just checking for any swelling, any bleeding, any decay, any fractures. Right now, I'm noticing that you don't have anything. Okay, like I said, it looks pretty good. Your teeth are in pretty good condition. You probably just need a good cleaning. I recommend going to the dentist every 2 to 3 months. All right, which means you should be going to the dentist at least 2 to 3 times a year. Okay. All right. At the very least once a year. Okay. At the very least, but I always recommend going if you have a little bit more money or your insurance covers it. I recommend going a little bit more often. All right. So next, I'm just gonna go ahead and rub your jaw gently. All right. Any sensitivity to any hot or cold items?
Yeah, when I buy a popsicle, it's like sensitive to my top and bottom teeth, like to like four of them.
Okay, so we're probably gonna have to get that checked out. You might have some cavities. All right. Or like I said, just due to the cleaning you haven't been getting, your teeth might just be sensitive. So I'm gonna just take a quick look at that real quick. All right. Actually, Hazel, can you go in this room, sit at the computer, take a look at the X-rays? I'm gonna go do some quick X-rays for her real quick, just to see what's going on, if there's any underlying problems that I don't see right now. Okay. All right, and just smile for me, Trinity. I'm gonna go ahead and capture some pictures and upload this to the dental portal and also your patient portal, and it's gonna get sent over to Hazel on that computer over there, so we can see what's going on really with your teeth. Okay.
Okay.
So just go ahead and smile for me. Okay. Do captures. All right. Just capturing some before pictures. right, and let me go double check because I also just want to see what it looks like on the screen. All right. So like I said, it doesn't look like there's any underlying problems. Like I said, it does look like there is a lot of plaque buildup, a lot of residue, food particles. It just needs to be cleaned out thoroughly, and that's probably what's, like I said, causing the sensitivity to any hot or cold items, but mostly them cold items that you know, you're eating, them popsicles and stuff. So what's happening is your body has a natural way, and since teeth are bones, they're automatically going to adapt. Okay, your teeth can adapt just like any other bone in your body, and so basically it's adapting. All right. Although you don't have any cavities right now, you are prominent to getting them or having gingivitis, which is gum disease. All right, and it has different levels to it. Yours is more of a milder case, like I said, because it hasn't even started, and we're gonna go ahead basically and prevent that from happening with this teeth cleaning. So Hazel, you can come back in here. We're gonna do a teeth cleaning, then we're gonna get back on schedule with the braces. Okay. And that's perfect anyway, that you don't have any underlying problems like cracked teeth or cavities, because we're able to just go ahead and jump into the braces. And normally we do teeth cleaning before braces anyway, because who wants braces on dirty teeth anyway? You know what I mean? You want to make sure your teeth are in top tier condition, and before you start to put any braces or grills on there. Okay, so let's go ahead and do your teeth cleaning. All right. Give me 1 second. All right. So, like I said, the first thing is pretty much just, preparation and cleaning. All right. I'm going to go ahead and insert this cheek retractor in your mouth so that you don't have to keep smiling. It just holds your mouth open while we take a look in it. All right. And we're going to go ahead and start to thoroughly clean and polish your teeth so that we can put this adhesive on there next for the braces. Okay. All right, so I'm just going to examine your gum line one more time, just to double check. I love to double check, make sure my work is good. All right, and now I'm going to go ahead and start to perform this thorough cleaning and scaling. So, Hazel, can you go ahead and hand me the scaler, please?
Can you tell me what I was saying?
Oh, yeah, I couldn't
Oh,
hear.
she was saying, could she pick the color?
Oh yeah, that's what I thought you were saying. Oh my God, you just read my mind, and that's why I didn't even know what you were saying. But I was literally about to say that, but I started lagging, or you guys started lagging. I couldn't hear you, but then I'm like, am I lagging? So I just relogged. But yeah, you can choose the color for sure. What color would you like? We're not even at that stage yet, but you can go ahead and choose the color so I can start getting that together as well. Okay.
Can I do like a pink and purple zigzag? Like some purple at the top and some pink at the bottom?
Oh,
Like
for
a
sure.
little zigzag?
For sure. That yeah, we could definitely do that. So, here's what we do to make it zigzag looking. We can do every other one, and then on the bottom we can do every other one. So, like on the top, pink, purple, pink, purple, pink, purple, and then on the bottom, purple, pink, purple, pink, purple, pink. So that when you smile, it looks like it's a zigzag, and then you have pink and purple. You get that?
Yeah, that's how I wanted it.
Perfect. Sounds good. Yep. And I can make sure I go ahead and put that in the notes as well. Or Hazel, can you put that in the notes in the dental portal, please? Thank you for that scaler. I'm going to go ahead and start to clean her teeth thoroughly. And basically, we're just going to try to remove any excess plaque, all that plaque that you have. And basically, plaque is just like a tartar. It's a hard, like residue that sticks mostly on the back side of your teeth and in between your teeth. It can be really bad and can start to conform and go to the front side of your teeth, but most times it's on the back and in between. So, we want to make sure that we get all that off. And it's basically like from like your food particles, your drink intake. I removed all the excess plaque. It looks really good. And we're getting somewhere now. Now your teeth are starting to be really nice and clean, okay? So I'm really just gonna apply this fluoride treatment now. And it's just a protecting enamel. It further cleans your teeth and protects your teeth before I start to put the adhesive on there for your braces, okay? Next, I'm about to just apply this Profi paste. All right. And like I said, this is just to further remove any plaque. I want it as smooth as possible. All right, before I start to put the adhesive on your teeth. All right, now I'm gonna go ahead and put an etch gel on there. This roughens your teeth. So basically, we just smoothing your teeth out. We just smoothing your teeth out, right? And so it's so smooth that it's not gonna pretty much keep the braces on there. The smoothing process was to help clean it. Now we have to roughen the outside of your teeth so that just a little bit so that the adhesive can stick on there. All right, and that's what the etch gel is just basically for. All right.
Will it hurt?
No, it won't hurt. That's a really good question too. All right, none of this hurts right now, okay? And when I get to the part that it may hurt, I'll let you know, okay? All right. So I just applied the etch gel. All right. Hazel, can you go ahead and hand me it's called Transbond. Can you hand me the Transbond off the counter over there, please? So that I can apply it. Transbond is just basically the adhesive that I was telling you about. All right. And it's pretty much going to help the bracket stick on the center parts of your teeth.
Knock, knock. Knock, knock.
Thank you. Thank
Knock,
you.
knock. Knock, knock. Knock, knock. Knock, knock. Knock, knock.
Gilbert, you know it's me. I'm trying to get my teeth done here.
Like I said, this just takes out the moisture from your mouth and it helps
Knock,
the
knock.
adhesive stick on your
Knock,
teeth.
knock.
So now I'm going to be
Knock, knock.
applying the
Knock, knock.
brackets to each
Knock,
tooth
knock.
carefully.
Knock, knock.
And this part isn't going to hurt as
knock.
well. All right.
Knock, knock.
Okay.
Wait, till I'm doing me?
Yes, give me a freaking second. I'm trying to get my teeth done here. I can't talk right now because I don't want to rub this stuff off.
Hey, I just want to see. Let me record this.
Bro, don't let him come in, please.
No,
Knock,
no.
knock. Knock, knock.
Like I
knock,
said,
knock,
next I'm going to go ahead and
knock,
put
knock.
the brackets on each tooth, center them carefully. All right, I'm going to use the same Transbond adhesive that I used at first just to put each bracket on each tooth. And if that doesn't work, I have another adhesive that I like to use. It's called Brace Paste, okay? But the Transbond usually works, and like I said, that's why it's a go-to that I like to use. If it didn't work, I would have just used brace paste though. So I carefully put each bracket on each tooth, all right, with the Transbond XT adhesive. So now all your brackets are in place. All right, now we're basically gonna just put the arch wires through each bracket, and that's pretty much what hold the brackets up. Okay. All right. But first, before I put the arch wires through, I'm just going to curate and make sure that the adhesive that I put on there for the brackets is hardened. I just use an LED light, and it's a machine called Ortho Cordless Valo, and I pretty much just like it because it emits strong blue wavelengths to pretty much just harden it real quick. All right. And I'm going to start it off at like 420 nanometers at first. If it doesn't work, then I'll just adjust it to its highest setting, which is 480 nanometers. All right. 420 nanometers work perfectly. Usually it does. All right. And it's just going to help quickly dry and harden that adhesive so that those brackets aren't moving everywhere. You don't want your brackets sloppy. You don't want them out of order. You want them to stick and stay in the middle of your teeth centered. Okay. Now, like I said, we can get to the arch wires. All right. Quick thing real quick. Hazel, can you hand me some pliers, please? So in order to put these arch wires through, we gotta carefully guide the wires through each bracket that we centered on your teeth. So it's little slight holes, and we're gonna do this for the top rack and for the bottom rack. Like I said, none of this right now is supposed to hurt. The overall process, once we put the braces on, it may be a little tight, and so that may cause pain that you're not used to, but it shouldn't hurt. It just might be uncomfortable pain. And so then I'm just gonna give you some medication at the end, some slight meds, such as a benzocaine, which is basically like an oral gel, or some Tylenol or some type of acetaminophen. All right, but until we get to that, it should be no pain, like I was telling you. Okay. Thank you for those pliers, Hazel. All right, so now I'm going to go ahead and use these wine guard pliers to go ahead and insert the arch wires through the brackets, okay? So this is when the color comes into play. A lot of people think the brackets are the things that are the colors, but really it's the O-rings that go over it. They're also called ligatures or like bands. They basically go over the brackets, okay? And they add the color around it, okay? So now we're going to go ahead and put these small elastic bands over to hold the arch wires in place, and it's going to go over the brackets. So it's a process of a process of a process, okay? And like I said, this is where the color comes into play. I already know that you want pink and purple, and you want it to be zigzag. So we're going to go ahead and put these in order like how you want, and I'm going to take my time to make sure I don't mess up, all right? And Hazel, if you want, you can go ahead and assist with that as well. So you can just put /Drew applies purple /pink O-rings. O-rings. And it looks like that. You can put /do applies purple /pink O-ring bands. Or just O-rings, however you want to say it. And we're just going to take our time with this. You know, we don't want to mess up. We don't want the bands to pop, because sometimes they can be super sensitive. And it's more than natural if you eat something, especially sharp items or, you know, meaty foods, things of that nature, they may pop. So you may have to come back in just to get them adjusted. You know, but for for an overbite, it shouldn't take long for your teeth to adapt. It's not like you have crooked teeth or any teeth that are, you know, misplaced or missing or cracked teeth or anything like that. Your teeth were in pretty good condition. It was just you had a somewhat huge exaggerated overbite. Okay, perfect. Thank you, Hazel. Everything looking good. All right. And lastly, this is the last step. We just want to make sure we trim any excess wire from those arch wires. We don't want it pricking your gums. We don't want it sticking you in the inside of your mouth, catching on any food, like I was already saying, or just causing any unnecessary irritation, all right, in your mouth. So we go ahead and clip and trim the excess wire, all right? And now we're pretty much all done. So now I'm going to go ahead and take some after pics. And I'm also going to go ahead and give you this mirror so you can take a look. Go ahead and smile and tell me what you think and how you feel, all right, about them. Let me know if you have any questions, comments, or concerns. And then I can go over any at-home procedures that I think you should do to sustain your braces, okay? But go ahead and smile for me.
I like them.
Like them, that's great. I'm glad you like them, and that's our best. We like to make sure that, you know, our patients are happy, they're comfortable, and, you know, bring your smile back to life. That's what we love to do, okay? So anytime you need any teeth cleaning or any further assistance, we're always here to assist you and help with your, you know, your dental needs, okay? So it's not recommended or necessary that you follow up with an appointment. It's totally up to you. But we can definitely get a follow-up appointment for you if you would like. And that could just be to take the braces off, and then, you know, there's a whole procedure for that, and then to also give you or administer a retainer. So we'll have to make a molding for your retainer so that, you know, you don't want your teeth going back to how they were before the braces. Your teeth, like I said, adapt very extremely fast, and if you don't wear a retainer, they may go back. It's a high chance or possibility that they can go back to how they were before. That's why we always do a molding, and we make sure that we do a retainer for your after procedure process, okay? So it's totally up to you. I recommend at least a week or 2 weeks, and it could be around the same time, or you can take down my Discord and you can schedule an appointment via Discord, okay? All right, so I'm just going to go ahead and put my Discord in the chat. It's totally up to you. And if you would like to follow up with that, you can, okay? But I'll put it at the end, okay? All right. And then lastly, like I said, I'm not going to leave you hanging. I know you might have a little bit of slight uncomfortability or pain due just to the stiffness and the you're not used to having braces on your teeth. It might be a little tight, which they're supposed to, so that your teeth can start to, tighten and not be, so far out with that overbite. So I'm going to go ahead and give you some medication. And I'm just going to prescribe you 200 milligrams of ibuprofen, which is basically just Advil. All right. And that's good for inflammation. And then I'm also going to prescribe you a little higher dosage of acetaminophen, which is basically just Tylenol, okay? And studies have proven that Tylenol not only helps with pain, but it also helps prevent teeth movement for some odd reason. But yeah, so the Tylenol is definitely going to help with that. And lastly, like I said, you can go to your local pharmacy for any benzocaine. Benzocaine is just like a local oral gel. You take like a pinky amount, rub it on your gums or the outer part of your upper teeth and bottom teeth near your gum line, and it just helps soothe your teeth, okay, and your gums, so it's not feeling any or as much pain or inflammation, okay? All right. And then lastly, I always love to do this. I have a goodie bag. And what would the dentist be without a goodie bag? You know what I mean? So I like to give you guys a goodie bag just to make sure, you're feeling A-okay when you go home. I don't want to leave you hanging, okay? So just give me 1 second.
Can I eat boiled peanuts with braces or no?
Boiled peanuts.
Yeah.
That's different. Yeah, you can eat whatever you like with the braces. I just ask that you don't eat anything within 30 minutes to an hour after this procedure. So you have to wait a little long. Don't drink anything within 30 minutes, but don't eat anything within 30 to an hour. 30 minutes to an hour, okay? All right. Thank you for the goodie bag, Hazel. All right. Handing me that. And I always just recommend just to brush, gently twice a day. You floss at least once a day. All right. And you can always rinse your mouth with warm salt water just to make sure that there's no bacteria and you don't get a lot of inflammation. Okay. Lastly, it's normal to feel any sensitivity with hot or cold items within 24 to 48 hours, so 1 to 2 days. And like I already told you, avoid, immediate eating for at least 30 minutes to an hour after this procedure. All right. And I'm gonna go ahead and put my Discord in the chat just so that if you want to come back and you want those braces off, or you want to schedule a follow up, if you don't go anywhere else, you're always more than welcome to come back to me. All right, and I'm gonna print out this copy. Hazel, can you go get the copy, please, and hand it to her? All right. Also, along with the info packet, you can print that out as well and hand it to her. And then you're more than welcome to take off the gown. And then Hazel, you could also hand her the discharge papers. So the info packet and the discharge papers.
All right, here's your information.
All right, thank you. All right, have a good day. Perfect.